Imagine standing up from your chair and suddenly your heart races to over 120 beats per minute. You feel dizzy, exhausted, and sometimes you even faint. For thousands of people across the United States and the United Kingdom, this isn't anxiety. It's a misunderstood condition called postural orthostatic tachycardia syndrome, better known as POTS. But what makes this disease even more fascinating is that doctors have been describing its symptoms for over 150 years, yet millions of people are only hearing about it today. This is the forgotten history of POTS. Long before modern medicine understood the nervous system, physicians noticed that some patients became weak, dizzy, and developed rapid heartbeats whenever they stood up. In the late 1800s, these mysterious cases puzzled doctors across Europe. There were no blood tests, no heart monitors, and certainly no clear diagnosis. Many patients were simply told their symptoms were psychological or caused by stress. During the First World War, military doctors encountered soldiers who experienced severe fatigue, rapid heartbeats, and dizziness without obvious heart disease. The condition became known as soldier's heart, or Da Costa's syndrome. At the time, doctors believed it was linked to the stress of war. But many of those soldiers were likely suffering from disorders that resemble what we now recognize as POTS. For decades, the condition remained hidden under different names. Some patients were diagnosed with chronic fatigue, while others were told they had anxiety disorders. Many spent years visiting specialists without receiving clear answers. Because routine medical tests often appeared normal, countless people were left feeling ignored. Everything began to change during the 1980s and early 1990s. Researchers studying the autonomic nervous system discovered that some patients experienced an abnormal increase in heart rate when they stood up. Their blood pressure often stayed relatively normal, but their heart had to work much harder just to keep blood flowing to the brain. This discovery led doctors to officially recognize the condition as postural orthostatic tachycardia syndrome, or POTS. Although awareness slowly increased, the condition remained relatively unknown for many years. Most medical schools dedicated very little time to teaching it, and many healthcare professionals rarely encountered diagnosed cases. As a result, patients often waited years before receiving the correct diagnosis. Then came the COVID-19 pandemic. Doctors around the world noticed something unexpected. A growing number of people recovering from COVID-19 continued to experience racing heartbeats, dizziness, overwhelming fatigue, and difficulty standing for long periods. Researchers soon realized that many of these individuals met the criteria for POTS. Suddenly, a condition that had been overlooked for decades became the focus of major scientific research. Today, scientists believe POTS may develop after viral infections, autoimmune responses, physical trauma, or even surgery in some people. It affects the autonomic nervous system, the body's automatic control center responsible for heart rate, blood circulation, and many essential functions. Women between the ages of 15 and 50 appear to be affected most frequently, although men and children can also develop the condition. There is still no universal cure, but treatment has improved dramatically. Doctors now combine lifestyle changes, increased hydration, carefully supervised exercise, compression garments, and medications to help many patients regain their quality of life. Research continues around the world, hoping that future discoveries may reveal more effective treatments, and perhaps one day, a cure. The story of POTS reminds us that some diseases don't suddenly appear. They simply wait for science to finally understand them. What was once dismissed as anxiety or unexplained weakness is now recognized as a genuine neurological condition affecting countless lives. And as medicine continues to advance, forgotten diseases like POTS are finally receiving the attention they deserve. If you enjoy uncovering the hidden history behind real diseases, subscribe to History of Disease. Every day, we explore the medical mysteries, forgotten discoveries, and scientific breakthroughs that have shaped human health. Because sometimes, Understanding the past is the key to protecting our future.